Hello, everyone. Thank you for joining us for Arthritis Talks. Find freedom from pain strategies that work. I'm Dr. Sean Bevan, Chief Science Officer at Arthritis Society Canada. While we've come together for this event from many different places, I would like to begin by acknowledging the land on which I am located on and on which our Toronto office stands, which is the traditional territories of the Mississauga of the Credit First Nation, Anishinaabe, Huron-Wendat, and Haudenosaunee Indigenous peoples. Today, this meeting places home to many First Nations, Inuit, and Métis peoples, and I am very grateful to have the opportunity to live with my family and work on this land. Now, an arthritis diagnosis often comes with a significant amount of pain and discomfort that can be very difficult to manage. But thankfully, that pain doesn't have to define your life. There are proven strategies to help manage it. Today, we welcome back Susan Johnston to provide practical, evidence-based information on pain and how to effectively manage it. Now, before we get started, just a few logistics. This webinar is best viewed on a laptop or desktop computer. If you experience any technical difficulties, please email arthritistalks@arthritis.ca for assistance. If you have a question for our presenter, you can submit it through the Q&A button at the bottom middle of the screen, not the chat, please. We'll try to get to as many questions as possible during the hour that we have together. You can click on the chat icon also in the bottom middle of the screen to access the chat and connect with other participants, as well as our chat moderator. However, if you find that distracting and you would prefer to close the chat, just click the X icon to exit out of the window. To enable closed captioning, click on the Show Captioning icon in your Controls toolbar at the bottom of the screen. Now, ahead of World Arthritis Day, coming up this Sunday, October 12th, Arthritis Society Canada has partnered with Leger Healthcare to release an alarming new report that reveals the hidden toll arthritis is taking on our workforce. Arthritis is the #1 cause of disability in Canada. It costs us over $33 billion every year in healthcare expenses and lost productivity. Yet only 4% of Canadians recognize it as the top cause of disability. In our survey, we found that 85% of people with arthritis in the workforce say it already has limited their ability to work or expect that it will. And yet, only 24% have received workplace accommodations. This lack of awareness has real and painful consequences, ones that I know many of you feel every single day. I encourage you to read the full report at arthritis.ca/news and spread the word. Now, with that, you are here tonight because you or a loved one lives with arthritis, and you come with really important questions to find relief. Many questions we received in advance follow similar themes, so we will get to those first before we go into a live Q&A at the end of the session. Now, it's my pleasure to join today's expert, nurse educator Susan Johnston, who is joining us from British Columbia. So welcome, Susan. Could you start us off by walking us through why is it so important to manage pain effectively?
Thanks very much, and thanks for having me here. So the big reason is that the more we tolerate pain, like we put up with it, what research is showing is that we lay down neural pathways into our brain. So kind of like if you practice the piano, a language, a game, we get better and better at it as we practice it. So we're laying down neural pathways. So we do that thing faster, better, and more effectively. However, we have also found that we do the same thing with pain. If you tolerate pain, you start building neural pathways so you will feel the pain faster, better, and more effectively. And you don't want to be doing that. So this is why managing pain becomes really important. Now, a lot of people will tolerate pain for fear of using medication and things like that. And I really, really want to encourage you to learn about medications and other ways of managing pain so you don't build those neural pathways, because these changes in our brain are not permanent. As we know, if we stop practicing something, those neural pathways start to retreat. We start to forget how to speak Italian if we don't practice it. And it's the problem of the body being too sensitive. I want you to think of your nervous system like a dial on a stereo. No, the more pain we have, that volume goes up. The more stress that causes, the volume goes up. That starts to impact our sleep, volume goes up. And what you want to do is incrementally turn that volume down so the nervous system isn't so sensitive to pain. Okay.
Okay, so thank you for all that great information. We know that many people want to avoid managing pain with pharmaceutical medications if they can. So, do you have any suggestions for non-pharmacological approaches to manage pain?
Actually, there's lots you can do. Mobility aids. So what we're doing here is anything, any arthritis below the waist, you want to offload it. That means using walking poles, canes, or walkers. What we can do is offload that joint by 30, sometimes up to 40%, depending on how efficient you are at using it. Now, I know one of the reasons why people don't use a cane is because they think it makes them look old or disabled. But I assure you, if you are limping and you're in pain, you look older. The cane doesn't make you look older. It makes you look more, actually more sure on your feet. You're going to be more stable. You're going to be in less pain because it stabilizes you, and you're going to have more endurance. So walking aids become really important. Cane would be like, I'm going to walk my dog or going grocery shopping. Walking poles are for, I'm going for a walk, I'm going for a hike, and you want to offload both sides. Walking poles give you a more full body workout as well. And then walkers, what's wonderful about walkers is they actually offload even more. Plus, they always have a seat. So you always have a place to pace and break up activities. And that is actually one of the biggest things you can do. Don't walk too long, stand too long, sit too long. You always want to be breaking up activities and being aware if you've been standing too long on a painful knee, then you break up that activity. In a walker, you always have a place to sit. The other thing, we want to offload weight, like with the mobility aids. So a walker allows us to pile all our crap in it and carry, and that carries it. So we're not putting that weight on our bodies. And using strollers and things like that to pull our groceries and things like that, offload weight from our body as well. Then joint stabilizers like braces. So we can have elastic braces. Now, what elastic braces do, you can get from London Drugs off the shelf, or you can get fitted by a occupational therapist. What these do is they act like your ligaments and tendons, but on the outside of your knee. So there's a myth I've heard often that using braces actually keeps you from using your muscles, and that's actually a myth. Braces actually allow you to use your muscles correctly, keeping your joint in alignment so it's not moving around so much, because it does start to move around because the joint's getting shorter and more compact, moves around. And if you let that happen, you can start building osteocytes, or what you know as bone spurs. We don't want to do that, so we want to brace that joint. And then other things like offloaders, which are more those a little bit more robust braces, and they've got hinges and straps and things like that. They actually offload. With the your elastic braces, they stabilize, but they don't offload. You can get braces that will offload for you, particularly helpful for the knee. Then orthotics is actually, just think about having a really good shoe, something that really fits your foot well, really stabilizes your foot, is very comfortable and supportive. So you put in orthotics into your shoes. You want to think of this. Your feet are at the very bottom of your body. They're taking all your weight. So the more comfortable and supported they are, the more comfortable and supported your knee will be, your hip will be, and your lower back. Then, of course, exercises. So what we recommend is, of course, walking and hiking, but you should be offloading using braces and walking aids to do those kind of exercises. You'll just, your joint will just last longer. You'll have more endurance, all of that. Otherwise, anything in water. When we're up to water to our neck, we're offloading by 90%. We're literally weightless. I have a dear one who has really significant arthritis, and she is in the pool 6 times a week. To quote her directly, I run like a gazelle. So she's not The weight isn't keeping her down. She's not in pain. She's really able to move her joints. And movement in our joints is the only way our joints get fed. They're not fed by a blood supply. They're fed through movement. So you gotta move. And the other thing is cycling. So even a stationary bike, just think about when you're on a bike, you have full range through your hip, your knee, and your ankle. So you're really able to move those joints without putting a lot of pressure through. And then seeing a physio is recommended, even just to be assessed. A half an hour assessment with a physio. They can tell you if you're limping. You don't want to be limping. Trust me on that one. You don't want to be limping. They can assess that, and then they can give you exercises so you can build muscle around that joint, because that helps stabilize the joint. And if you're looking at a joint replacement, that's your scaffolding for your new joint. So a physiotherapist, or at least once for assessment or ongoing for further help. And then lastly, ice is your friend. It's really your friend. Getting those ice packs that are flexible when you freeze them, and you just put it on where it hurts. So ice is good for inflammation, but arthritis isn't typically always inflamed, but it still hurts. So what you're doing is fooling the nervous system to feel cold instead of pain. That's why you're using the ice, and you can use that on and off all day as much as you need to. So those are the things to do before medication.
Okay, that was great, Susan. So many great insights there. Now, what if someone needs to complement the non-pharmacological options with other options? What are some safe ways they can use medications to manage their pain?
Mhm. Yeah, where you want to start always is topicals or ointments, things you're putting on your skin. Now, over the counter, you can get things like, sorry, Voltaren. This is a very powerful anti-inflammatory in this. And Aspercreme, Zostrix, these kind of things are all topicals. Now, they don't work great on the hip. You can try it on the hip. The hip is a very big, deep joint, so it's hard to get topicals in there, but you can try, particularly putting the ointment into your groin. The key with ointments, though, is consistent and persistent application. Just putting it on and expecting it to work isn't the way they work. A couple times a day for at least a month before you're really going to get a good effect. And I've met people who are able to get off all oral meds by just using a topical. Then you would add in acetaminophen, so commonly known as Tylenol. So Tylenol is just a brand. Acetaminophen is the drug. And why we encourage trying acetamin first is because it's got no side effects and it's generally safe with all other medications. So that's a big plus. And the type you should be using, it's what's called extended release. So Tylenol has a Tylenol arthritis formula. And why you're looking at that is it lasts for 8 hours. Whatever you take a medication, you want it to last a nice long time. And really the key for acetaminophen, which I understand and through research, is taking it before your pain gets bad. So if you know your pain it gets pretty bad about 2 in the afternoon, then you should be taking your acetaminophen at 1, maybe even at noon, consistently. Your arthritis doesn't magically go away, right? You need to manage that pain so you can exercise, move comfortably, rest, sleep, and enjoy your life. So the extended release acetaminophen is what I recommend. Read the bottle and follow the instructions. Then up would be NSAIDs, non-steroidal anti-inflammatory drugs. Things like ibuprofen, naproxen are examples of this. Now, these are to be used with your acetaminophen, ideally, unless your doctor instructs you to use them exclusively. The issue with NSAIDs is they have a lot of side effects, right? Acetaminophen, no side effects, complementary with other drugs, whereas NSAIDs are a little more complicated. They can upset your stomach. They can increase your blood pressure. They can thin your blood. Can be problematic to the kidneys. And yeah, that's the issue with them. So taking them once in a while, typically people notice none of these problems. That's why you would take them with acetaminophen. If you have breakthrough pain, or you've had a particularly busy day, maybe you've got some inflammation. I do encourage trying ice first, but NSAIDs can also be quite helpful. They usually work really well. However, the side effects. So if you're diabetic, kidney disease, bleeding disorder, these kind of things, just talk to your pharmacist before taking them. And yes, they're totally safe to take together. NSAIDs and acetaminophen are very different. They're compatible. They don't contraindicate each other. Then when all else fails, a narcotic. Now, the cannabis isn't on this presentation. I will be doing a cannabis presentation in a month or so. It comes in ointments. It also can be prescribed by your doctor. Talk to your doctor about that. Then narcotics. So narcotics is really when all else fails. You're maybe at a maximum acetaminophen for a long period of time, or these medications really aren't working and you're still awake at night. The ointments just aren't cutting it, that kind of thing. You've kind of exhausted everything. Then you need to use a narcotic. This is a good indication that you likely need the joint replaced if you require a narcotic. Don't be hesitant. You have to sleep. If you're not sleeping because of pain, this is a big problem. It's what we stimulate our immune system when we're sleeping. So if you're not sleeping well, your immune system is really suffering. So yeah, those are some of the suggestions on medication and how to use them.
Perfect. Okay, so before we get into the Q&A from this session, I always like to ask our presenters, what excites you about the future for those diagnosed with arthritis today?
Yeah, well, needless to say, education is always helpful. And I'm excited about that programs like this are informing people and people want to know about it. So as I've already mentioned, is cannabis. Why I'm excited about cannabis is that it's not toxic, meaning you cannot fatally overdose on cannabis. You can certainly overdo it, don't get me wrong, but it is showing quite a lot of promise in terms of particularly arthritis care. So have a look at that. Join me for the cannabis talk. And really, once again, you start with an ointment. A topical when it comes to cannabis is a great way to start with that. And needless to say, general self-care modalities such as physio and movement, walking aids, and using braces. Once you really start using these things, you will really notice a positive impact on your arthritis.
Okay, that's wonderful, Susan. Thank you for all of that. So not surprisingly, we have received many, many questions already this evening. So I think we'll just jump right into them if that's okay with you.
Absolutely.
Okay, so in many different ways, this question was asked, but how do you decide between managing pain with heat or cold or both or combination? What does that look like?
Okay, I love that question because my rule of thumb is ice is for your joints, heat is for your muscle. So you really want to avoid heat on an arthritic joint because you don't know if there's inflammation in there. It can be quite hidden, and heat can exacerbate inflammation. But heat's great on tight muscles. They're sore, they're tight. I've pulled my back. Some heat is nice for that. It relaxes the muscles. Whereas ice is always the choice for the joint itself. It will numb it, so you get rid of the pain, and it will also help address any kind of inflammation. But you can certainly ice your hip and then put some heat on your thigh muscle, for example. You could use them both at the same time, but rule is ice for joints, heat for muscle.
Okay. And do you have an opinion about ice baths in particular?
Oh, ice baths. Well, once again, it is prescribed for things like arthritis of the hands, right? Where you dunk your hands into ice water, then you would put them into really hot water, and then you end with an ice bath. So once again, it's just like that ice. It numbs the pain and it reduces inflammation. So that's what you're using it for. And if you find it helpful, there's nothing wrong with it.
Okay. I'll stay on the temperature topic for a second. And it's about why someone's asking here, why is our climate so difficult for my arthritis? So why is the cold climate causing me more
Mm,
pain?
mm-hmm, mm-hmm. That's a good question. I would postulate when it gets really cold, our joints get a little stiffer. So I always talk about the synovial fluid. Our joints are surrounded by a sac of fluid called the synovial sac filled with synovial fluid. And how our joints get fed is moving within that solution and pressing and opening that lubricates it and feeds it. However, when it's a little cold, I want you to think of it like gravy. All right, when gravy's warm, it pours nice, it moves really nice, no problem, but you leave the gravy sitting on the counter and it gets kind of solid. So I'm always telling people, warm up your gravy. Before you move the joint a little bit. You're going to stand up, or you're sitting down, and your knee is really bothering you. Move it, like get it moving first, then stand on it. Your hip is sore, you're sitting, grab your thigh, pull it up to your chest a couple of times, rotate it around a little bit, then start moving. So I think cold kind of does that. And then when it's warmer, we tend to move a little bit better because things are a little looser.
Okay. Someone here is talking about, we hear that motion is lotion, but what if motion is painful? So what is that threshold? How do you know when you're at the threshold and
Right.
when to stop?
Yeah. My question when people say, no, it hurts too much to move, I'm always like, what are you taking to manage the pain? A lot of people don't want to take medication to manage the pain. But pain is not the enemy when it comes to arthritis. Inflammation is. You don't want to leave something inflamed for a long period of time. So, inflammatory arthritis, we really need to make sure that the inflammation is in check before we really move the joint. But with osteoarthritis, it's not typically inflamed, yet we're not moving the joint because it hurts too much. Then you medicate. You like, I'm going to go to the gym, and every time I go to the gym, man, it really hurts. Okay, then take something before you go to the gym so it doesn't hurt. Remember, managing the pain before you have it, you're going to get a better effect. You're going to build muscle, you're going to feed the joint, and you're going to be more comfortable. So pain is not the enemy. Really, the pain of osteoarthritis is you can feel the pressure between the bones. Nothing is broken. Nothing is bleeding, and nothing is going to get particularly worse. So, really, you're kind of looking at pain will increase a little bit with exercise, and then it should drop off in a couple of hours. It should be tolerable too. It shouldn't be awful. It should be tolerable, and then it drops off in a couple of hours. It certainly shouldn't keep you awake, right? You got to move the joint. If you're not moving the joint because of pain, you need to take something for the pain.
Okay. You gave some great information about braces. So a few questions here. One around, should you be wearing a brace at rest? And even at night, should you be wearing a brace for your arthritis?
Hmm, not particularly necessary. It's really when you're moving the joint. And we're not moving that much while we're sleeping. Though I've met people who found, I have a friend who has problems with her wrist, and she finds that she's actually more comfortable bracing the wrist at night because she's moving it around or rolls over it, and it hurts her because she's moved it. So she braces it at night. It's really, there's no harm in bracing when you need to. So that's kind of like you be the best judge. It's certainly not necessary, but you definitely want to brace if you're exercising, going for a walk, the day-to-day stuff, just put elastic brace on and make sure it's as stable as possible.
Okay. A few questions here about whether you have recommendations about controlling pain when you have or when you have arthritis in your back. And someone's also asked if there's a back brace that people can consider.
Hmm. Well, you can brace any joint, including your back. I do not have a recommendation specifically for a brace. That's really an occupational therapist you want to talk to. But there's lots of places that will fit you for a back brace. So yes, you can brace your back. In terms of pain management for the back, needless to say, it's complicated. It depends on, is if it's nerve pain, muscle pain, is it actual bone pain? It varies, right? And determining what the problem is the start. But you can go all the way from just basically your acetaminophen, anti-inflammatories, that kind of thing. Definitely topicals can help with back pain. Cannabis has been shown to help with back pain. There a study just came out about lower back pain and cannabis use and that they saw a positive outcome with that. So there's that. And then if you're describing pain that radiates down, like you've got a pinched nerve, then something like gabapentin, which is a classified as an anticonvulsant, has similar effects as a narcotic. However, it's not classified as a narcotic. You do have to be weaned off of it once you stop taking it, but it can help with nerve pain specifically. So yeah, the usual thing, topicals, acetaminophen, anti-inflammatories, and if required, a gabapentin.
Okay. And I know that you touched on this, but someone is asking just for clarity. So why would you use acetaminophen and NSAIDs together? Like, could you just remind, like, what is the benefit of that?
Okay. Really, you're starting off with acetaminophen and seeing if you control the pain well with the acetaminophen. That's what you're trying that. So we have the extended medication that will last up to 8 hours. You can take two of those 3 times a day. That's your absolute maximum, though. I've met people how they use the acetaminophen is they use the extended release, and then they'll use extra strength, which is actually a slower dose, but it delivers the medication a little quicker because the other one's extended release. So they'll mix those. It's still acetaminophen, but the technology behind it is a little different. But let's say you've had a long day. You've been on your knee, like I'll just say you've been standing on your knee, you've got knee arthritis, you've taken two Tylenol arthritis 2 hours ago, it's still really hurting. You put some ice on it, that's fine. But as soon as you take the ice off, it's still kind of painful. This is a perfect time to take an NSAID. You probably do have some inflammation in there. And you can take it. You've got acetaminophen on board managing some of that pain, but that NSAID will kind of take the rest of it away. And then, unfortunately, for people with inflammatory arthritis, acetaminophen might not do the trick, but an anti-inflammatory will. And that's usually prescribed by your doctor, your rheumatologist, that kind of person. They'll guide you in how to take your NSAIDs because, unfortunately, they do have these side effects.
Okay, that was a great answer. So does the approach to managing pain, does it vary depending on the type of arthritis you have? So if this person, for example, has both osteoarthritis and rheumatoid arthritis, so do they need to consider things differently for each?
Yeah, I'm sorry to hear that. That's really tough. Well, with the inflammatory arthritis, you should be seeing a rheumatologist, following the instructions of your rheumatologist. So they will have you on immunosuppressive drugs that reduce the inflammation. And like I've said, no matter what kind of arthritis you have, inflammation's the problem, right? We don't want inflammation because that is what deteriorates the joint. So in terms of pain management for the RA, really following the instructions of your rheumatologist, talk to your pharmacist as well. Your pharmacist is your medication oracle, right? They're the boss. And they can help guide you around your immunosuppressives and any kind of anti-inflammatories. The acetaminophen may be helpful, The ice may be helpful. So unfortunately, it's complicated. The reality is rheumatoid arthritis kind of causes osteoarthritis. It's an inflammatory disease that deteriorates the joint and kind of causes all this inflammation and irritation. Osteoarthritis is just wear and tear on the joint, and then it can become inflamed, but it's not an autoimmune response. So yeah, you can have both. It's really hard when you do, but really following the instructions of your rheumatologist and really giving a try to these there's a lot of new medications out there for rheumatoid arthritis, and there's a lot of opportunity to really help yourself by following those instructions of your doctor.
Okay. I don't think you touched on this yet. Do you have any recommendations for people managing pain when they have arthritis in their hands?
Oh, yeah. Well, I briefly mentioned the contrast bath, the ice water, right? Icing, heat, always end with ice. And this, it's like ice numbs the pain. Then the heat allows you to get everything moving, getting those muscles moving. And then you end with ice just to make sure you're not going to cause any inflammation. Then bracing, right? You can brace individual knuckles. You can brace the thumb. You can brace the wrist. So there's all kinds of good bracing for the hands. And then pacing and breaking up activities. You know, like let's say you're cooking dinner on Friday and it's like a little bit more elaborate than usual. Can you prep a little bit on Thursday? Or even prep a little bit on Wednesday and do a little bit more on Thursday rather than doing it all at once when your hands are really hurting. And then maybe you're a knitter and you like to use your hands. Pace and break up that. Just knit for a little bit, put it down, do something else, then go back to the knitting. Knit a little bit, put it down, do something else. So you're not in a lot of pain at the end of it. It's with osteoarthritis, it's overuse. Overuse is what causes a lot of the pain.
Okay, let me go to another body part then. What about your shoulder? Any advice there?
Physio, bracing. Once again, like I said, you can brace any joint. So, and then physio, building up muscle. The problem with the shoulder is it's kind of floating out there. Your shoulder actually isn't really attached to you. It's attached by muscles and tendons and all that kind of stuff. So physiotherapy tends to help with that, but pain management is exact the same. Acetaminophen, anti-inflammatories, topicals are great, icing, that kind of thing, and then definitely bracing with the shoulder.
Okay, I'm hearing some themes here for sure.
Yeah.
So when you're talking about ice or heat, actually, do you have any sort of time recommendations that people should be considering when they're doing it? How long for?
Yeah, yeah, it's I'm I'm more like ice until it doesn't hurt anymore. Um, my what I recommend people do with icing, because it's like you don't want to ice too long because the circulation gets uh, um, slows down when you ice, and then it's like that's not good either. But how I do it is ice till it really doesn't hurt much, and then take the ice off and move the joint, move it because it doesn't hurt, and now you can move it. That warms up that synovial fluid a little bit, but it doesn't hurt to move it. So, they say like 15, 20 minutes, take it off for half an hour, put it back on if you want, that kind of thing, on and off, on and off. But I know people who put an ice pack on their knee and go to sleep.
Hmm.
But, your body will slowly warm it up and it eventually sleep's more important than worrying about the ice being too cold on your knee. Do protect your skin. It's one thing I should say. Do protect your skin. Ice can burn your skin, right? You should have a tea towel or something like that as a barrier between your ice pack and your skin.
Okay. You mentioned Voltaren and sort of topical creams. A few questions here around, can you use them long term? Um, is there a maximum number of times you can use them per day? And so I'm going to ask you a third question. I can remind you of them, but
Yeah.
the last one here is around, is it the actual cream that's helping, or does the physical motion of putting the cream on help your arthritis as well?
That's good. No, the physical motion isn't doing anything. Yes, you can use them indefinitely as long as you're not having side effects, because some of them, like Voltaren, is an NSAID, right? So your maximum amount of times per day would be 3 times. I think under instructions it's 2 times. But at first, you may want to like 3 times as the weeks go by. Oh, I'm noticing an effect, then back off on that the middle of the day. So begin morning and night usually is enough, but it does take a while before it takes effect. As far as I know, you can use them indefinitely as long as you're not having side effects. And the side effects that you would notice with this kind of systematic use is upset stomach, you're bleeding easy, you cut yourself and it just won't stop bleeding, or any kind of headache or anything like that. Maybe your blood pressure's up, or if you have any kidney issues, you may need to talk to your pharmacist before using this kind of stuff. So it's usually okay. Topicals are fairly safe. The other thing to consider is if you're starting to take oral NSAIDs at all, then you need to back off on your topical. You shouldn't really be taking both at once because you will get side effects if you do.
Okay, you just mentioned headaches actually, and someone has asked here, is there any connection that you know of between osteoarthritis and migraines or migraine
Oh
pain?
God. Yeah. Well, my arthritis is in my neck and I get migraines. So, yeah, like when you think arthritis in the neck of any kind, you have a risk of developing headaches because of that. I have arthritis in my neck, and there's times where I get a pinched nerve and I get nerve pain up into my head. So, yeah, it can happen. Um, I have tried everything, honestly. I have really tried everything, and I finally went to a neurologist, and got on a very specific kind of anti-inflammatory, and it actually worked. So can't tell you what it is right now. I don't have it here, but talk to your doctor about that if you need to. But yeah, there's definitely a connection between osteoarthritis, specifically in the neck, and it could cause headaches. Yes.
Okay. Okay, changing gears a little bit. What should someone bring to their first physiotherapy appointment?
Well, depending on the pain that you've been having, you might want to take a Tylenol before you go, right? Dress appropriately. And just like I teach about pain in my pain management class. I teach with Oasis. We do free webinars. I do pain management every 2 weeks. You can sign up anytime you want. So I went on a tangent there. What to bring to a physio? Oh, yeah, pain
Uh-huh.
diary.
Mm,
Yeah, I talk about a pain diary. So pain diaries, you can get them on your phone, like as an app. And what you're doing with the pain diary is kind of tracking the nature and pattern of your pain, what makes it worst, what makes it better, what medications you're taking, when you take them, are you using walking aids, all this stuff. And with the diary, that's a great thing to share with your physio or your doctor, in terms of what you're already doing and what do you think would help, what would augment with this. Yeah.
that's great. You talked about assistive devices. So do you have any tips about how people should be using walking poles or canes? And one person in particular says that when they use a cane, they get pain on the other side of their body. Does that mean they're using their cane incorrectly?
Okay. So with the cane, you should stand up nice and tall, drop your hands to your side, and the cane's handle should hit you at the wrist. So that's first. So make sure your cane is the right length. Then your cane is always in the opposite hand to your affected leg. The medical show House, I don't know if you remember that, the
Yeah.
doctor used his cane wrong. He had it on the same side as
Love the
his
show,
joint,
though. Love the
painful
show.
joint. So don't get your medical advice from these shows. So opposite arm, opposite leg, that's the way we walk. And then take your time, right? Really notice how you're walking. When your foot hits the ground, your painful foot, that's when your cane should be on the ground and you're really pressing on that handle. That's how you offload, because you might be doing a bit of a flump, 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 even though you're using the cane and now your good leg is starting to hurt. So just make sure your mechanics are correct. If you're not sure, orthopedic places, so places that fit you for um, braces, those occupational therapists will happily watch you just use or a physio too, watch you use your cane and make sure you're using it correctly. So that's the cane. And then use it all the time. The more you use it, the more habit it is, the better you are going to be at using it. Now, with walking poles, we actually really like a set of walking poles by a group called Urban Polling, and the poles are called activators. So Urban Polling, and they're called activators. And I think you can get them Canada-wide. And they were developed by an occupational therapist. And what we love about them is they have a big fat handle. So if you have a hand arthritis, the fatter something is, the easier it is to hold. And then it has this flange on it that your side of your hand hits. So you're pressing on the flange as if you're pressing on the top of a cane. Now, our regular walking poles for, hiking poles don't have that flange. They just have a strap. So you don't really have anything to offload other than really pushing down on the pole, which is fine for some people. That's totally fine. But if you really want to up your game, these types of poles with this flange that you can kind of, I call it karate chopping. You kind of karate chop through it, press through it, and that offloads the other side. And the beauty of walking poles is you offload both sides. So if you have pain on one side and or it's developing on one side, walking poles will really kind of even it out. Helps with posture. You're getting more of a full body workout, getting a cardiac workout. They're absolutely fabulous. I've started to use them myself, and I don't have arthritis. They're just fabulous. So urban polling makes activators. So those kind of polls can be very helpful. I think that answered the question, yes?
Sure did.
Oh, okay.
What about at work? What kind of accommodations or modifications can people think about for managing their arthritis pain at work?
Mm. Well, medicate before you go to work. Like if you know it's going to hurt while you're at work, make sure you have medications either beforehand or available to yourself. Bracing, once again, consider bracing. And then if you have a job where you're standing up, where's the opportunity for you to sit down for a second? Remember, don't want to walk too long, stand too long, or sit too long. Or if you're in a job where you're sitting a lot, take breaks, even set an alarm, right? Every 20 minutes, 30 minutes, get up, move around, move your legs up and down. Like basic, really simple exercises go a long, long way. So just remember you got to keep moving it, but you also don't want to overuse it. So breaking up the activities remains a number one thing to be doing. So finding a little seat and just parking yourself on there, or you're sitting down a lot, just like, oh, I'll go get the water, and you get up and go get the water for everybody, kind of thing, right? Kind of really start making those plans to really make yourself more comfortable at work.
Thank you, Susan. Okay, you talked about this in the context of hot and cold. So someone has asked, how do you tell the difference between whether you're having muscle pain or joint pain?
Ah, uh, well, that's a good question. How I how I describe arthritic pain. So muscle pain I find is crampy, is kind of how I experience muscle pain. Whereas arthritic pain, the analogy I use is if you're sitting in a cushion chair, you can sit there forever, right? Nice cushion chair, comfy wumpy. But if you're sitting on something that's hard, like wood or concrete, we don't have any cartilage. That is what is worn away. When we have arthritis, cartilage is worn away. That's what now I have exposed bone, bone on bone, pain, pain, pain. Because the surface of our bone has lots of nerves. So now when I sit on something hard, that we all have experienced this, we eventually start getting an achy butt, right? The butt starts to ache because it's just bone and muscle. And so what do? We stand up. We stand up, we get off of that pressure. So arthritic pain is almost like a pressure, and it's deeper and it's more of an ache. Whereas muscle is more, a lot of the time I find muscle will be a bit tender to touch a little bit. It'll be crampy. And then if I touch or squeeze the muscle, then I'll notice, oh yeah, it's a little sore. Whereas the joint, if I squeeze the joint and it hurt, it might not increase the pain at all. You might not notice anything, but the pain is deeper because it's really between those two bones. I hope that helps.
That was a great explanation. Um, can you explain how cortisone shots work?
Hmm. Uh, Well, they are an anti-inflammatory. Basically the strongest anti-inflammatory you can get. So when you get a cortisol shot into a joint, they're injecting that solution into the synovial sac. So that solution goes in where there's likely a lot of inflammation. Now, a lot of people get corticosteroid shots and it does nothing. And the reality is they probably don't have any inflammation. It just hurts a lot because they can feel that pressure through the bone, but it's not necessarily inflamed. So the corticosteroid shot, if you notice it really helps, you likely are dealing with some inflammation in there. So that's good information at least. But the thing to remember about corticosteroid shots, just to add in here, is it should be your last resort, not your first resort. Evidence shows that it can actually increase cartilage loss. It is invasive and it is not a fix. It's very temporary. I always recommend people do corticosteroid shots when they've talked to their GP and their GP have said, we need to get you on a list to get you a joint replacement. You likely have a year to wait before you're even going to see a surgeon. This is the perfect time to try shots. Once you see your surgeon, you have to be very careful. You want no shots within 3 months of getting a joint replacement.
Okay. Um, so picking up on the joint replacement comment there, are there different ways that you would manage pain before or after surgery? And I think someone's asking
Mm.
here because they say they had a successful surgery from like a mechanic's perspective, but they're still feeling pain.
Um, Well, one, it depends on how far out they are. If it's a knee replacement in particular, it can take a long time, unfortunately, for the pain of a knee replacement to kind of slowly dissipate. A friend of mine, it took, I don't know, 6 months. It took a while. Remember, it's getting all the pressure from your whole body through that knee, and it's just this hinge joint. The hip can take it a little bit more. Most people don't have a lot of complaint about hip pain after surgery. Managing it is kind of similar. Usually with a joint replacement, after joint replacement, you are on a narcotic as well as acetaminophen, and then they wean you off of the narcotic and you stay on the acetaminophen. That is ideal. The other evidence we found is that the better our pain is managed before surgery, the better our pain is managed after surgery. So I guess my question also is, how well were you able to manage your pain before surgery? And if you weren't able to, or you weren't, because people just tough it out, right? And you weren't, you may be just more sensitive to the pain, and it's just going to take longer for it to dissipate. But same principles, acetaminophen, ice, uh, not don't overdo it, that kind of thing, and definitely follow the instructions of your physio. And the other thing I always like to comment is your physio does not end with the last appointment after your surgery. So we're given so many physio appointments after hip surgery or knee surgery, but you got to keep going. You don't just stop, right? You're continuing to do physio, making sure that that muscle stays strong. You got to make this last for the rest of your life. So keep at it and use the same principles as before pain. But if it's really problematic, like it's been 3 months and you're still having pain, then you need to, you should be talking to your doctor, even your surgeon, because 3 months you should start to feel a little more comfortable and able to more or less return back to normal.
Okay. Um, a question here, but is there any evidence that TENS machines help with pain?
Certain kinds of pain for sure. I'm not a physio, so that is a really good question for a physio. They can help. I'm all like I'm all for therapies that, they're not going to do any damage. They may help. Go for it. Give it a try. But that is definitely a question for a physio. I've met people who just like they love their tense machines. I've met people who's like didn't do anything for me. So it's a matter of just perspective and giving it a try.
For sure. You talked earlier about the importance of getting a good night's sleep. So, any particular recommendations about how to help manage pain at night, or mattresses, pillows, that kind of thing, to help people get that good
Oh,
night's rest they need?
oh, that's a long discussion, but I'll do my best here. Um, like if you're noticing pain before you like you if it's consistent, like use that pain diary, right? Like be curious about yourself. So maybe you need to take medication before you go to bed so you don't have pain while you're sleeping. You can certainly use ice. I always tell people it's way easier to go to sleep with a cold knee than a painful knee, right? So icing becomes very important. As for bed, mattress, all that, like using pillows to elevate a knee, because if the knee is straight and that hurts too much and it's bothersome, get a pillow under the knee and have it slightly bent. But remember, when you wake up, you want to move it, get it moving before you use it. No recommendations on mattresses. It's really, what's comfortable. Really, sleep hygiene is all about, do you have a routine, right? Before bed, informing your nervous system it's time to go to bed. Um, uh, Put all electronics, particularly that dang phone, it needs to be away from you an hour to an hour and a half before bed. This dopamine, 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 dopamine is a stimulant keeping us awake. Also, light. All lights should be down, like an hour before bed, dimming lights around the house. The only kind of light should be what you're reading an actual book with. And then have that routine of going to bed at regular times, managing the pain before you go to bed. You know, 2 Tylenol arthritis it will last you 8 hours, right? That's your maximum dose. So, give that a try. Oh, that worked great. I'm at zero pain. Okay, then just back off on one and just try one. Does that work? No, not quite. Okay, then you need two. You can also include, so ibuprofen will last about 6 hours, but a naproxen, which is stronger, will last 12 hours. But you will notice side effects faster with naproxen if you have to take it all the time. So just be aware of that. Questions about your meds, go to your pharmacist.
So you mentioned really about bad light before bed, if I could put it like that. Is there
Yeah,
any evidence though around any light therapy that actually could help with pain relief?
pain relief, light therapy.
Hmm.
Not that I know of. There's definitely light therapy that can help with sleep. So the idea of, if you've ever heard of seasonal affective disorder. So what this is when we don't get enough UV light. So UV light makes us produce serotonin. We're all in a good mood when it's sunny outside. But when the sun sets and it becomes dark and we have serotonin, it drops and that signals the brain to release melatonin. So we sleep. If we're not getting enough UV light, very common as the days get shorter, nights get longer, we're spending more time inside, we can develop sleep issues, having trouble sleeping, having a depressed mood, these kind of things. Get outside and get some light into your eyeballs. Even on a cloudy day, if there's a glare, that's UV light. You can also use a full spectrum light in your home to get that light into your brain. And this can be very helpful for sleep. I'm not familiar with light in regards to pain management. I'm sure that's another physio question because they're the ones who use the equipment.
Yeah, that's great. Okay. Is there any evidence around menopause and arthritis pain? Anything that you can share with us about that that you've heard from
Oh,
people?
yeah, no, not really. I um I mean, I think it's just like aging is not for wusses. You know, it's just like it's hard. It's hard to age. It's just hard to age, and menopause included. Um, the concern more with menopause is more osteoporosis, right? Where you are losing bone density, and this can be related to our hormones. That's more of an issue. Arthritis, like osteoarthritis, is more related to genetic predisposition because your hips are the same as your mom's hips and your grandma's hips, and they all had a hip arthritis, and yeah, lo and behold, you have it too. um, or job related, you're a floorer and you're on your knees all the time. Yeah, you're probably going to pick up, develop things like that, or previous injury, or weight, like having a lot of weight, body weight, because for every extra pound we carry is 4 pounds of force through our hips, 6 through our knees. So if you're carrying a lot of weight, so with menopause, we often put on a little bit of weight, then we're increasing that pressure through those joints. So weight, maintaining our weight becomes quite helpful in managing arthritis, particularly in the knees, right? So menopause has more to do likely with weight, and the struggle. So really kind of looking at that as more of a component of the arthritic pain than the menopause itself.
Hmm. Okay. I think this is a good question here, actually, that many people have asked us. Are family doctors the right experts to go to for osteoarthritis that people should be consulting? Or are there other healthcare providers that people should be going to, pain clinics? Who are the best people to help us with our arthritis?
Yeah, your GP is a general practitioner. They know a little bit about a lot of things. Um, They're not going to be able to give you the time you need. This is why Oasis is a great program. I'm just going to toot my own horn here, because we're a free program within Vancouver Coastal Health, which anybody can attend our webinars, and we teach you how to self-manage. So with osteoarthritis, it's really learning how to self-manage, how self-manage the pain and all of that, and getting some exercises and doing them. You're like a physio is a really excellent person because one of the main things we got to do is keep moving. So a physio is really important in that. However, if you're in too much pain or you've let it go too long, a physio might not be the best person. So I do think education is key, through Arthritis Society, for example, definitely. This is going to empower you with the information you need and kind of get you started. Seeing a physio if you can afford it. And then pain clinics, yeah, clinics can be very helpful. I mean, arthritis is like, it's as statistics as you've seen as we started this, they're huge. So it behooves pain specialists and GPs and all that to learn more and learn more of how to help their patients. So if you're not satisfied with your GP, then talk to your physio. Not quite getting there, take a class with Oasis. Or, if you have the funds, do a pain clinic, like desperate time calls for desperate measures. But are you doing a lot of the things that I am suggesting that you do? If you haven't quite got all those in line, then that's where to start, right? You got to move, got to medicate to make sure you move, build muscle. Have I mentioned you got to move?
Okay, I'm going to try to sneak in a couple more questions. Building on this healthcare team theme, what is the difference between a physiotherapist and an occupational therapist?
Physiotherapist is going to work on your joints and your muscles, right? They're going to help you build those and keep them healthy, all of that. An occupational therapist is somebody who knows what tools to use. So they would tell you what kind of the walking aid would be best, how to bracing. Oh, that's an occupational therapy thing, bracing. Um, uh, fattening up the handles on something, like maybe you have arthritis in your hands, using the different equipment to garden with, that kind of thing. That's more of an occupational therapist. Think of occupational therapists as tool specialists, in particular related to movement, and your physios are your joints and your muscles and getting them moving and lubricated and working.
Okay. And I do not want to spoil your upcoming webinar, but what if people want to do a little bit more homework before then? A few people have asked, who should people go to if they want to learn more about medical cannabis?
Me.
Okay.
You can, there are cannabis clinics across Canada via telehealth. Do I have anything at hand? Anyways, these clinics, I don't
Don't worry,
have my
we can share in the
stuff here.
chat. Don't worry, Susan. Yeah,
Okay,
we can share.
yeah, so there's cannabis clinics that are GPs who prescribe, and they're via telehealth. But I'm not completely sure because I've inquired, and GPs would prefer, your doctor would prefer you are referred by your GP to that clinic. That doesn't mean you can't contact them, go to their website, see what they have there. And those are GPs who run the clinics and will prescribe. Prescribing cannabis is actually called authorization. The other person who might be able to answer some of your questions is a naturopath, because they can also prescribe, right? Or authorize. So a naturopath maybe have some information. It's an herb, right? A certified herbalist is another person you can talk to. So that those are the specialists. You can go to dispensaries and talk to the local bud boy, but they're not going to really know a lot about a medical background, medications that you're on, that kind of thing. So be aware of that.
Okay, Susan, thank you so much. That was amazing. Thank you for sharing all of your knowledge with us today. I'm pretty sure that was a record in terms of how many questions I've been able to ask the presenter during one of these arthritis talks. So sincere thanks from all of us.
Oh yeah, but
And congratulations, that was impressive. We would like to take a few minutes just to get the audience feedback on today's presentation. So for those of you joining live on Zoom, you'll see a poll question come up on your screen with some answer options. So click on the response that reflects your thoughts about what you think. We will also be sending you an evaluation form when we email the recording and the slides. So if you weren't able to access that poll question, you'll have the opportunity to give us feedback at that time. And we really do use the survey feedback to shape our future arthritis talks. So if you have a few minutes, we do value your input. Now, before we wrap up today's session, I'd like to bring your attention to something that is having a real impact on our work right now, the ongoing Canada Post strike. We are facing our second major postal strike in less than a year, and it's happening right before our most critical fundraising period. The delays caused by this strike are jeopardizing essential programs and life-changing research. When donations slow down, so does our ability to deliver programs and services to people who count on them. Your support right now really makes a difference. I hope you will consider making a secure online donation today at arthritis.ca/donate to help us during this really challenging time. Just remember that any amount does help. Now we will be back again in November for another Arthritis Talks focused on physical activity. Stay tuned to your email for more information on that webinar. And then Susan will be back again with us in December for an Arthritis Talks focused on medical cannabis. So once again, we are grateful to our donors for their financial support of this event. And that concludes tonight's Arthritis Talks. On behalf of all of us, thank you for joining us today, and please stay well.